Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Teach. So today we will be discussing another field case study and this one is going to be very interesting. Okay, so before going to the lecture, some formalities. Yeah. This is my Facebook channel. Okay. In the same name, Vet Surgery at Each, here you will find the pictorial presentation of different procedures. All the surgeries I don't have videos to post in YouTube, so most of the time I post pictorially in this page. Same name, Vet Surgery at Each. You can like this page. Also, this is my YouTube channel. You already know it. Please subscribe to this one. You will find a subscribe button here in your mobile or a laptop. You can subscribe it here. Also, you can check out different other videos, okay, like this one is anesthesiology series, this is MCQ series, okay, there are many series, you can check them. Now coming to our main class, okay. So a case was presented to the veterinary dispensary where I work, okay. You can see here this one is fractured, okay, the mandibular symphysial fracture. So the case was mandibular symphysial fracture, which was 3 days old. The calf was 3 days old. Okay. So during time of the birth, this happened. The history was there was dystocia. So due to the dystocia, the nearest LI tried to pull it out. So he made a hook by 8 mm rod. You see 8 mm rod. See, 8 mm rod is used for house building. So what he did, he bent this one. He bent this one to make a hook. Okay. Sometimes they make jugadu. Okay. They arrange some things whichever material available to make like a hook, but sometimes they create a big problems. You should not do that. But with no infrastructure, he made this hook with 8 mm rod, and when he made the hook and tried to pull it out by putting it in mandible. So this bone is mandible, the upper one is maxilla and the lower one is mandible. Okay. So he tried to pull the fetus out by hooking it to the mandible. Instead, what happened, due to the heavy weight of this fetus, you can see here, can you see a large gap? You see this gap? Okay. The soft tissues were torn apart and soft tissues were avulsed, to be correct word, avulsed, and the symphysis was fractured. You see this symphysis was fractured. You can see a white, I will enlarge this picture. See, here see, you can see a clear gap, okay. The soft tissues has been avulsed and you can see the fracture here, okay. This is the symphysial fracture, this is symphysis, the mandibular symphysis, okay. This one is right mandible, left mandible, okay. The symphysis, and the symphysis was fractured. So this was the case which was presented to our dispensary. So what I did cerclage wearing of mandible under the sedation of xylazine. Okay, under the sedation of xylazine, I did the cerclage wearing. You can see the cerclage wearing here. I will enlarge this picture for you. See the pin here, the wear. The wear used was 20 gauge orthopedic wear, okay, 20 gauge orthopedic wear. See this wearing. How this wearing happened, I will tell in next slide, but just look at the wearing, okay. And here you can see the clear gap. You can see this clear gap, okay, caused by that 8 mm rod while pulling out the fetus, okay. Now, how I did, you can see the outside pin, outside the wear, okay, wearing. I will tell you how I did it, so you can understand it clearly. You see, these two are 16 gauge needle. In 18 gauge, the 20 gauge wire won't pass very nicely. You can use 16 gauge needle and insert on the left side, on the right side, and through which the wire will pass. Okay, after that, pull these needles out and simply tight the knot. You can see how it happens, how it looks. See the previous image. See here, the circle is wearing. Okay, now after I did the circlage wearing of mandible, I also did circlage wearing of the incisor teeth. Okay, this is central incisor. Okay, this I also did the circlage wearing of this central incisor. I did both circlage wearing of the incisor teeth and also the mandible. Okay, so post operatively I gave antibiotics. I won't tell which antibiotic or what dose rate because I don't like quackeries to develop. So I gave antibiotics, anti-inflammatories, calcium supplement are necessary for bone healing, and I advised for glycerin and chloramphenicol washing of those tissues which was avulsed. See, these tissues are avulsed. So to avoid any sepsis or any infection, I advised for glycerin and chloramphenicol washing regularly, to wash twice daily, so that there won't be any sepsis of this one. Systemic antibiotic is I have already given systemic antibiotic, but the local antibiotics are also important for management of wound. You see, oral wounds heal very nicely and very fast also, you will see. Okay, also I advise the owner to feed the animal by hand feeding. Next, on day 10, I regularly took follow up. The owner was a very nice person and he was an educated one, so he gave me feedback each day. So on day 10, the interdental cerclage wearing was removed automatically. Why? I will tell you now. You see, this teeth is growing. This teeth is growing. Okay, so when it will grow, the base will become narrower. Okay, so this cerclage wire will get loosened up. Okay, when it will loosen up, it will get out. Okay, so that is why on day 10th the cerclage wire was removed, but it is not a big of concern because the mandibular cerclage was present. Okay, and also see, sometime the case was from 40 to 50 kilometer away from my dispensary, so they can't bring the animal each time for a checkup. Okay, but I told keep this mandibular cerclage wearing intact and try to take care of it. The owner did very nicely. He took care of this cerclage wearing of mandible, and on day 20 there was pause at the cerclage wearing of mandible. You see here. Here you see this thread, this small thread. Okay, so this thread, sometimes what happens, the animal will grow. When they will grow, it may injure this site and there will be pus formation. Okay, see this one, this may injure one and it may cause some pus person. It is very common, you don't need to worry. So what I told the owner, to start the antibiotics therapy. So when antibiotic was continued for 3 to 4 days, the sepsis was gone. Okay, so I asked the owner on day 20, how is the animal? He said, I am still feeding with hand, but the animal is fine. The oral cavity was healed up. Now on day 30, I received the good news. See here. See, the animal is eating straw here. See, here the animal is eating straw and you can see there is a slight gap between the incisor teeth the left and right, because the interdental cerclage wearing was removed before maturity, but there was callus formation. With time it may remodel. Okay, I will update it when it remodels, but animal is eating nicely and also you can see here drinking. Okay, the animal is surviving and the oral mucosa has been healed very nicely. Okay, now watch the video. Okay, the animal is eating the dry roughage, the straw, also some fodder, and here the animal is drinking. Okay, you can see drinking and feeding video. This is 30th post operative day. Okay, 30th post operative. 30th. You see the bone, in case of this is new net. Okay, or you can say young calf. In young calves the healing is very fast. Okay, because they are growing. When they will grow, the healing will be much faster than adults. Okay, if this case would have been adult cow, it may have taken more days, maybe 2 months or like that under field conditions. Otherwise it should take 1 month. Okay, so under field condition it may take more days because of lack of education and lack of care. Okay, so what we learned here? What we learned? First, I already told, in every field you need very good owner counseling. Owner counseling. You see, in this case, this particular case, the owner was educated. So I didn't have much pressure, or I told the clear cut picture and he understood. Okay. So owner counseling is important, particularly if the owner is not educated. Second, in neonates, fracture heals very fast. Okay, so you don't need to worry that whether there will be healing or not. If you are doing the surgery right, then the healing will be very fast. Okay, you don't need to worry. You just need to support the animal and the animal will recover. They are not like humans. Under slight, if they will be a slight wound, they will go, no, the animals know how to survive. Okay, the third one, the cerclage wearing. You understood the procedure of cerclage wearing in case of symphysial fracture of mandible. Okay, symphysial fracture of mandible. You know the procedure now, and you can apply in the field. And for quacks who are watching, some quacks I know they watch my video, please don't try. Okay, they know where to insert the 16 gauge needle. If you will insert wrongly, or you can insert in some arteries or veins, then it may cause problem. Okay, fourth, proper instrumentation for dystocia. Proper instrumentation. You should not do any jugadu methods or whatever available methods, particularly in case of medical field or veterinary field. You should use proper instrumentation. And second, last one, while pulling, pull the maxilla. Okay, you can apply rope to the maxilla, because the mandible is a separate bone. Okay, it can easily be dislodged or it can be dislocated, but mandible, the maxilla, it is attached to the skull. This won't get fractured easily, and this is attached to a bigger bone, the traction force will be better. Okay, so this is a very successful case report, and I was really happy that the owner called and told my animal is doing fine. This is the greatest satisfaction a veterinarian can get in field, when his or her patient heals up nicely. Okay, the animal will definitely survive. So we will meet in next class. Till then, tata, bye bye, take care.